Did you know that in the year 2000, the measles virus was declared eliminated in the United States? Fast forward 14 years, and one of the biggest measles outbreaks occurred at our very own Disneyland resort. I actually remember going to Disney during this time, and they were passing out free bottles of instant hand sanitizer. My husband and I were both vaccinated when we were young, so we didn't have anything to worry about. However, we still saw a ton of infants and babies there, and I just hope that they all had been vaccinated. In total, there was a reported 111 measles cases reported. About half of these cases were among unvaccinated people, most of whom were eligible for vaccination, yet intentionally chose not to be. Could this have been prevented? I believe the answer is yes. Should childhood vaccinations be mandatory? Once again, I believe the answer is yes. Hi, my name is Cheryl Bradley, and today I'm here to tell you why childhood vaccinations in the US should be mandatory. First, I will talk about why vaccinations are important for the overall health and safety of the public. Then I will talk about how vaccines save children's lives and protect them from diseases. Finally, I will talk about how they provide economic benefits for our society. Many people would agree with me when I say that vaccinations are important for the overall health and safety of the public. They protect the people in the world who cannot receive the vaccines because they are either too young to be vaccinated or can't be vaccinated for medical reasons such as a prior history of seizures or individuals with weakened immune systems. It should be our moral responsibility to be vaccinated for the safety of these people. Currently, I am pregnant with my first child and she is due this October. Now my family lives in the Detroit area of Michigan and we are hoping to fly home with our 4-month-old in February. However, recent outbreaks of measles in our hometown are now causing us to rethink our trip. Children are unable to get vaccinated for the measles virus until they are at least 12 months of age. This is going to be heartbreaking for us to not be able to share our daughter with our family members until she reaches that age. Vaccinations also greatly reduce the chance for an epidemic or an endemic in an area. As I stated before, the measles were actually eliminated in the US in 2000. However, in the 15 years following, there has been 1,400 measles cases reported in the US, with 42% of these cases involving individuals who are unvaccinated due to non-medical exemptions. Dr. Padkey of the Division of the Infectious Diseases points out that these outbreaks could have been avoided if vaccinations were federally mandated. In 1995, the chickenpox vaccine was introduced in the US. In a review article written by Mona Marin, she explains that a single dose of the vaccine was 80 to 85% effective in preventing disease of any severity. The vaccination program reduced hospitalizations by 88% and deaths by 74%. It is important to note that diseases don't stop at country borders. They can be easily spread at an international level. The Center for Disease Control reported that in 2014, the U.S. had a record number of measles cases, and the majority of them were associated with cases brought over from the Philippines. This is extremely scary because many of these diseases don't show any signs or symptoms for 2 weeks, so people that had the disease could be walking around infecting others without even knowing it. Now moving on to my second point. Vaccines prevent unnecessary diseases and they save children's lives. They are able to reduce your child's risk of infection by working with their body's natural defenses to help them safely develop immunity to disease. It is the most effective prevention tool available to our doctors. Now, even though it is gut-wrenching for a parent to watch their little ones getting poked with needles, the positive benefits of the immunization is well worth those 5 minutes of tears shed. Vaccines are clinically proven safe and they undergo extensive testing prior to being approved by the FDA. The Center for Disease Control explains that clinical development is a 3-phase process. During phase 1, small groups of people receive the trial vaccine. In phase 2, the vaccine is given to people who have characteristics similar to those for whom the new vaccine is intended for. In phase 3, the vaccine is given to thousands of people and tested for effectiveness and safety. Many vaccines even undergo a phase 4, which has to do with ongoing studies after the vaccine is approved and licensed. The theory of vaccinations causing autism has been proven false time and time again. One study in Denmark examined the link of MMR and autism in children born between 1991 and 98. They compared children who were unvaccinated versus children who had been vaccinated. Results concluded that of the 537,000 children, 316 were diagnosed as autistic and 422 were diagnosed as on the autistic spectrum. Of the children diagnosed, there was no significance in whether they were vaccinated or not. Parents have a responsibility to do everything they can to protect their children and make sure they are as healthy as possible. Rubella, diphtheria, smallpox, polio, whooping cough, they're now all prevented by vaccination, and millions of children's lives are saved every year because of these vaccines. Lastly, I would like to talk about how vaccinations provide economic benefits for our society. Vaccinations save citizens money by preventing lost productivity due to disabilities and early deaths. According to the International Vaccines Access Center at Johns Hopkins Bloomberg School of Public Health, $63 billion could be saved by providing Hib, pneumococcal, and rotavirus vaccinations to the 73 poorest countries. Vaccinations would also save $1.4 billion in treatment costs and $55 billion in lifetime productivity loss because of death. Parents that immunize their children typically have to take less time off of work due to children's illnesses. The Bill and Melinda Gates Foundation is an organization that works with developing nations to improve people's health and well-being. This includes the funding of immunizations to underprivileged families. Bill Gates notes that for every dollar spent on childhood immunizations, you get $44 in economic benefits. And that includes saving the money that families lose when a child is sick and a parent can't work. Another benefit of a parent taking less days off for a sick child is that they can save their vacation days to actually do something fun with their family. I remember while growing up, I would try and fake a sick day, but then I would realize my mom would have to take off work as well, and I'd feel bad about it. I would much rather put that time towards a fun family vacation where we would go on a road trip or fly down to Disney World. This translates to our family spending money on vacation and thus putting it back into the economy. In conclusion, I would like to share the fact that 12 deadly diseases have been cured in the 19th century due to the introduction of vaccines. This equates to millions of children's lives being saved. And this is why I believe childhood vaccinations should be mandatory in the United States. First, I talked about why vaccinations are important for the overall health and safety of the public. Then, I talked about how they save children's lives. And finally, I talked about how vaccinations provide economic benefits for the society. Today, I want to leave you with this. As a soon-to-be parent, I ask you to please get your children vaccinated. Not only is it for the safety of our children, but also for the well-being of future generations to come. Thank you.